Scotty Al-Samarrie, publisher of Diabetes Health magazine. I'm here with Dr. Bootle, who's working with Roche on their Infusion Site Awareness Week. Thank you for coming on our show.
It's a pleasure to be here, Nadia. Nice to meet you.
Great. Now you wear a pump.
I do. I wear a pump. I've worn a pump for about 12 years. I've had type 1 diabetes for about 27 years, so every day is a learning experience and I'm still learning something new. I'm based in Manchester in England in the UK, and it was a real pleasure to be asked to come and help launch the National Infusion Site Awareness Week, which is going to be launched on the 30th of August through till the 5th of September this year. I think for me the key word there is national, because it's across the whole of the US, so it's got a potential to actually help make a difference for something like the 400,000 insulin pump users in the US. So I'm really pleased to be here.
I saw your presentation and I liked it. One of the things that you had were tattoos for people to remember the different site locations.
Yeah, I really like the tattoos because, I mean, I've used a pump, like I said, for 12 years, and one of my issues, my nurse tells me that I should rotate my sites. She even shows me where to go in the time that I'm with her, but then when I go back into my normal day-to-day life outside of the consultation, I forget. I forget, well, I put a needle in, or I use a needle where you can use a little cannula, and that goes in, and that's very important of making sure the insulin's absorbed properly. But then I might move it to another site over here, and then I might put it back in a site that I've used in the last few days. And I know I shouldn't do that, but I've forgotten because life gets in the way. Right. And I know I should change my site every 2 to 3 days, but then it becomes 4 days or even 5 days. And actually, it just then becomes a problem that I'm not seeing.
You brought up an interesting point in your talk about how one of the ways that you realized that you had difficulty with the infusion sets was that when you realized your blood sugars were getting high and you realized that you possibly could be putting it in the same area, or you were having some type of complication that wasn't visible.
That's exactly right. We all talk about diabetes being the silent disease that damages your blood vessels and you don't see it. But that's exactly what infusion sites are all about, because you don't necessarily get the soreness and the lumps and bumps associated with poor site management straight away. But actually the insulin absorption starts to go off very quickly. And you start to notice it in your glucose excursions. But then you try to answer that problem by looking at your basal rate or your bolus management, and you forget about the very simple basics of the actual infusion site management. So what I'm really keen that this whole awareness week, working in partnership with educators, is we raise it up the ladder of importance. And that's so important because often the infusion site becomes the last thing we think about when we're with our patient. And that means that we're wasting time when it's very valuable to us in a consultation. But also from the patient's point of view, they could have got the answer earlier. So even if it's just something as simple as bringing the infusion site to the top of the agenda before we try and look at other problems.
How about the dates? How do you, when you have the tattoo in a certain place, is that indicative of, I mean, is there a date that marks it? Because one of the things that people forget is when to change them. They can't remember when they put it on. They
do. I mean, I do all sorts of things to try and remind me. I'll put it into my phone or whatever to alarm. But what's really nice about the tattoos is they're marked. The tattoos, you get a pack of about 24 and they've all got numbers on. And those numbers then, when you put the tattoo on, let me take you through it. You've got your little site, you've got your cannula there. You know you need to change it, so you take your cannula out. And at that point, you put these tattoos over that cannula site. There's a little circle where the cannula was in, so it lets the space that you've taken the cannula from breathe.
So you put it on top of the cannula?
No, you've taken the cannula out. So you've taken the cannula out, you mark that as the tattoo with the tattoo. It's got a little number 1, and then on the form you can write number 1 and the date.
Oh, that's right. There is a form that comes with that.
Yeah, so you've actually got a way of tracking the date. So you put today's date. I've just changed my cannula, so I've got a number 1 there, and then that's got the date. And then when I then decide to change it and go to my next site, you've got another cannula. You put the tattoo on. You put the next date on. So it actually gives you the ability to keep a log. So it's actually, you don't do it all the time, but you do it as a point of discovery to help actually make yourself aware to where the issues are and to try and change your habits.
Right.
And that's one of the issues with pump therapy. You get so used to doing it, it's part and parcel of your day-to-day life. Things become habitual, but actually some bad things become habitual.
Right.
And that's the issue. We're trying to break that cycle, and really like the tattoos because it's an experiential learning.
Well, hopefully if you're changing your infusion sets at the right time, you'll also minimize the high blood sugars.
Absolutely.
There's some positive
And that's then you start, once you've discovered the issue, you use the tattoos, then you might start to sort of believe that it makes a difference, because you'll link the tattoos and the fact that you've changed more regularly, every 2 to 3 days. There's a key motto for me: you change your site every 2 to 3 days, you actually stay at least 2 inches away from a previous infusion site, and then you don't go back there for 2 weeks. So it's almost 2 to 3 days, 2 inches, 2 weeks. And that now has started to become, even from my short time with the Awareness Week, I'm starting to have that embedded in my memory.
So that becomes a habit.
And it becomes a new habit, and I believe it makes a difference because I can see better or limited excursions and better glucose profile, which is all I want. So I'm getting closer to the success, the goals that I want, that I've agreed with my educator.
The tattoos are part of the kit. What other resources are available for people?
The tattoos are a very important part of the kit, but it's not the only thing. There's some fact sheets, there's some information materials in general. There's a really good DVD that's got Karen Flanagan, who's actually a certified diabetes educator, but she's also an experienced insulin pump user, I think 17 years. And I saw the DVD when I came over here. It's brilliant, it's really good. It actually gives a stepwise process with all her experiential learning, talking to a real life pump user and trying to actually help embed this simple approach to better site management. So that DVD is designed for CDEs, for educators to use with their colleagues as well, so other healthcare professionals, they want to get on board with this initiative, but also with their patients. It's very interactive. So that's really key part of the kit. And I think if people want to learn more about the materials and the way they can work in partnership with Roche Diabetes Care, I think there's a great website called infusionsitemanagement.com, which has all these materials on it, a way of contacting the company to learn more, and it's a way of getting started.
Great. Well, thank you for being on our show.
It's a real pleasure. Thanks for having me.
Great. From Diabetes Health, I'm Nadia Al-Samarrie.